I've always believed in speaking out in what you believe your truth to be. And I could have easily hidden from this and sat here in this bed and moaned and complained and just kind of licked my own wounds and died quietly. But you know what? That's not who I am. I want people to know that this vaccine, mRNA vaccines, not all vaccines, but these mRNA vaccines, they need to be looked at before we use them again.
And even still, and as the United States has... For Rebel News, I'm Tamara Ugolini here at St. Joseph's Villa in Dundas, Ontario, just west of Hamilton. And I'm in the room of Michael Oesch, who has been featured in a documentary by filmmaker Dean Rainey of Rainey Media with the title, Why Can't We Talk About This? And it details the severe and debilitating health decline of Michael following his fourth COVID-19 booster. And it's been about 2.5 years since that time, and been a few months now since the documentary was released. How has life changed for you since filming that documentary?
Well, when we started filming the documentary, I was still living at home. I was still able to get around with a walker, and that was in January of 2024 we started filming. And over the course of that 1.5 years, my health has declined. I was in hospital most of July, August, and September of 2024. I went home briefly for a period there, and eventually had to come to long-term care. I can no longer walk. I can barely move my legs, and my hands now are starting to deteriorate to the point where at times I can't hold utensils. I can't hold a cup. And I need personal support workers to do almost any basic task.
Now, I think that when Dean and I when we interviewed back at the beginning of May, you were celebrating, was it your 58th or your 59th birthday? 59th birthday, yeah. So happy belated. But does that make you the youngest person in this long-term care facility?
I think there are some younger people who have had traumatic accidents. I know I am the youngest person on this ward. But no, there is an under 65 club here, and there are people who have had other kind of accidents, whether they're car accidents or whatever, or suffer from other conditions that are here. But I'm definitely one of the younger ones here for sure.
Mm-hmm. So it's not an anomaly, but it's certainly unusual.
Well, they call me the resident of the future here on this ward because I have, Wi-Fi lights and Bluetooth this and that. And, I'm kind of a high-tech patient here with all the things that I can do. And it's nice because in a lot of cases, most of the residents here sleep all day, where I'm try to be as active as I can. Going
back to 3 years ago, or, the last time when you had your last shot, the fourth one, the government's messaging was really, we have your back. And at the same time that the injections were rolling out, they implemented the Vaccine Injury Support Program, VISP. Mm-hmm. How does that messaging line up now that you're, 2.5 years post-shot, post-injury, and having applied for the VISP program? And what has your experience been there?
Well, when I got my vaccine, I thought that I was doing what was expected of me, following the messaging that I was hearing on the news and in other medias. And, I got sick and I found out about the Vaccine Injury Support Program, and I applied in May of 2024. And you know what? It took a long time. They kept asking for more paperwork. They kept asking for this and that and the other. And I think it's in many ways, the Vaccine Injury Support Program is no different than an insurance company. In reality, they're trying to get rid of you by attrition. I just heard that my paperwork of my medical records has finally been accepted. So it only took, almost 2 years to get that. to get that done. And, now it has to go through the rigmarole of their doctors looking at it. And, the more you go down the rabbit hole about the Vaccine Injury Support Program, you realize that it's really not there to help the patients.
Mm-hmm, mm-hmm.
There's so little. Out of 2,600 people who've applied, only 188 have been accepted.
It's a fraction of a fraction.
It's a fraction of a fraction.
Yeah.
And that more money has gone to the administration
Yes.
of that program than to help the people that it was designed for.
Mm-hmm.
I don't know if I'll ever see that in my life. And at this point, I'm not banking on it.
Mm-hmm.
I'm trying everything to do what I can. I have to, I have outside physiotherapy that comes in to help me maintain my movement. I have outside massage that comes in to help me deal with the throbbing in my legs and my arms. And that's not paid by the government at all. It's not paid here by the long-term care facility. And it's taxing on my family and the resources that I don't really have.
Mm-hmm.
So it's rather a shame that they're not there for us.
Mm-hmm. What has been the response from the medical community, or perhaps some of the alternative doctors or modalities that you've sought out throughout the last few years? And what is your formal, what is the documented diagnosis?
Well, the thing is, the doctors, they want to help you. Most general physicians don't understand what's happening through this pandemic. They don't understand long COVID or the spike protein or COVID vaccine injuries, let alone the neurological condition that I'm going through. My naturopath has been very, probably the most forthcoming with alternative ways to deal with this through supplements, through different protocols, COVID protocols that have helped me keep my immune system up. Here's the reality of it. I can't walk. I can't move my hands, but my blood work is better than anything I've ever had in my life. Wow. And I'm keeping my body in as good a shape as I can, but yet neurologically I'm still deteriorating. And it's rather sad because, the neurologist that I have, he's a good neurologist, but currently this is just an idiopathic neurological condition and they don't know what's causing it. My neurologist, he basically said that he's never seen anything like this and he doesn't know what to do. There are several people that I've connected with who have been vaccine injured. Some to the extent that I am, whether they're quadriplegic. There are some that are dead, I know, because of the vaccine that they've taken. And then there are people who are minorly injured. Thousands upon thousands, maybe tens of thousands of people who are either suffering from blood clots or some type of either cardiovascular or respiratory condition or cancer that is not being attributed to the vaccine. And, it's rather a shame that this whole situation and the fallout of it is basically being whitewashed, and that's the truth. We're dealing with trillion-dollar pharmaceutical companies who are trying to, make billions of dollars of profit by giving $1 million bribes to not find the information that really is out there.
Mm-hmm. Getting back to the documentary and why can't we talk about this, which I think highlighting the fact that there are trillions of dollars involved in the rollout of these products. And I'll make sure to link the documentary for anybody who wants to watch it in the written component of this report so that they can find out more and watch that for themselves. But what has the impact of the documentary been on your life thus far?
Well, the impact of the documentary and why I did it was not how it is going to affect me. It's what it can do for other people. Realistically, I'm at a point right now where I don't think there's any coming back from the injuries that I've suffered. and the reason that I'm talking about it is because it needs to be talked about. And I've always believed in speaking out in what you believe your truth to be. And I could have easily hidden from this and sat here on this bed and moaned and complained and just kind of licked my own wounds and died quietly. But you know what? That's not who I am. I want people to know that this vaccine, mRNA vaccines, not all vaccines, but these mRNA vaccines, they need to be looked at before we use them again.
And even still, and as the United States has just done a massive policy shift and removed the authorization for these shots from basically anyone healthy under the age of 65, especially healthy children, pregnant women. And yet Health Canada and more recently, the Society of Gynecologists, they have issued a statement that these injections continue to be protective and recommended for pregnant women. What do you make of that disconnect and why the science may be different here in Canada?
Well, the science and the message that's being given out is not the reality. I don't know anyone who's still taking the vaccine. I talk to hundreds of people all the time, and they say, Mike, I'm not taking the vaccine anymore. And I think people have kind of come to the realization that that maybe COVID was not the boogeyman we thought it was going to be. And although it did, kill people with comorbidity and people who, had a susceptibility to dying from these things died. But in reality, I think we infected a lot of healthy people along the way.
Just in closing, do you have a message perhaps for the health bureaucrats or the health agencies, maybe one from the political class? I know your local MPP, Bobby Ann Brady, has been great, but she's an independent, so she has a bit of a more free leash to speak. Or perhaps your fellow Canadians who might not even know that vaccine injury exists.
Well, I think we all tried to do our part during the COVID vaccine or the COVID pandemic to do what we should do for this country, and I appreciate that. But I think you also have to realize that, there is a fallout of what's happened, and we can't hide our head in the sands, and we have to look at the answer that's staring us right in the face.
Yeah. Thanks so much, Michael. Again, thank you for having me here and for giving me your time. And I know that energy is short-lived these days, so I really appreciate you taking the time.
Thank you, Tamara.
For Rebel News here in Dundas, Ontario, I'm Tamara Ugolini. If you'd like to find more reports just like this one and support this kind of work, please do so at nomoreshots.ca. That's nomoreshots.ca.